Hello mamas, and welcome to video 2 of the series that I'm doing for you guys in this group. Last week we talked about stress management techniques for parents, and the second option on the poll was mental health for kids. And I think this is a really important topic, especially now. I mean, it always should be an important topic, but right now during this pandemic, it's been very hard on kids without having that social interaction. And I think there are a lot of factors that play into the mental health for kids now. There's even, technology and social media and just so much going on that we have to keep up with and have to keep checking in on them with. But I just wanted to quickly talk about, what impacts that they've experienced so far during the pandemic. So, there's that change of routine. They're not seeing their friends anymore. They're not seeing family members. They're not seeing grandparents. They're not seeing, sick individuals that they might normally see. So a lot of that is really hard and traumatic. We're not only, our adults experiencing a lot of loss and grief. It's a big factor for children as well. And, now they're in a change of routine because all the school is being done online. There's more virtual learning options. And, it's pretty obvious that we weren't equipped for any of this, for the access, the connection to teachers and students. And, we are still discovering new ways to stay connected online. But it's a change, and it's something that parents are now experiencing to be very difficult, and kids as well. So I do want to talk a little bit about the stress and the ways that kids deal with stress, because it's very different and unique for each child. So just to be mindful and look out of different patterns that you see in your kids' behavioral changes, like being excessively irritable or excessive crying in younger ones, lack of sleep, lack of focus, lack of concentration, more irritability, things like that. If you're seeing a lot of that and, the unwanting to do any kind of activity but, be on the iPad or something, not wanting to do homework, not wanting to do things that they used to love doing, that's all normal, and it's completely okay for them to be, experiencing this, because it is stress. It's a form of stress and anxiety, and that's how they are coping with that. And, if you've experienced some kind of traumatic event in your life, some kind of grief or loss, it's very hard to, pinpoint exactly one type of change in yourself, your behavior, your mental health, and it's different. It's different for every time. I've experienced numerous losses in my life, and the way I coped with it and the way I handled it has always been different. And so it's hard to, see it in a child, and it's hard to know if this is because of the loss that they've experienced, the loss of, or I guess the change in routine, the change in socializing and everything else that's going on, or if it's just something that, is school related. They don't want to do school. Like, how can you tell if it's just an age appropriate mechanism that they're trying to fend off, or if it's stress and anxiety in their life? And you really can't tell. So that's why you just have to be very open, having open lines of communication and constantly checking in on them. Well, not constantly, but a daily check-in, just to know that they're doing okay, and they can come to you when they are feeling upset and frustrated. So I do want to talk about some things that you can do if you see these behavioral changes. And if not, these are still things that you can do, because the pandemic is hard on everyone, especially kids. So what can we do to support them, right? We can actively talk about COVID and, answering questions that they have about the outbreak and about ways that, they can stay safe and feel secure, because at the end of the day, that's what they want from you, and they want out of life. They want to feel secure. And, maybe it's not on their minds right now, these questions. Maybe that was something in the beginning, but still having that open line of communication, talking about what's going on around us, being very, in tune with the world around us. Some other things is just reassuring them that they are safe and that they are, they're perfectly healthy. We're healthy. We're doing everything we can, as long as we are sticking to the guidelines. We're wearing our mask, we're social distancing, things like that, but you're safe and you're okay. But we talked about this last week, acknowledging when we're feeling angry or frustrated or upset, just being aware that this is happening, so then we can cope with it. We have to be aware in order to take the next step, and kids are the same way. But they need your reassurance that this is an emotion that they're experiencing. They need your reassurance that it's okay to feel upset, and that they have every right to feel upset. I mean, imagine being in, I always try to put this into perspective, imagine being in their position, not being able to go to school, having every kind of social interaction ripped away from you, having all these fun activities that you do as kids ripped away from you. It's really, really hard, and I just can't imagine what they're going through. So I think being able to reassure them that this is perfectly fine for them to feel upset. It's perfectly normal that, they're experiencing this withdrawal from school, or they're experiencing this withdrawal from even family and friends, and that they're coping with it in ways that are maybe frustrating for you, but it's an okay thing. And once they are able to recognize and see your reassurance, you'll see a huge shift in their behavior, I'm sure. Another thing is just acknowledging that, but also talking about the ways that you deal with stress and helping them learn to cope on themselves. If you're one to take a walk when you feel stressed, or if you like exercising when you feel stressed, giving them the opportunity to maybe do it with you the next time. And so you guys can kind of band together and fight off the stress together. And, it'll be a really great bonding experience as well. But that is something that I'm sure that they would like to know how you deal with stress and see that you're also experiencing this new emotion maybe for them, that you've experienced it and you know how to cope with it. Another thing, limit exposure to the news coverage. I see my older generations constantly watching the news, and they just get paranoid. And sometimes kids are the same way. They see something in the news, or they see something in social media, and they just blow it out of proportion, or they find, news that's probably not true, and they are just misled by it. And so that's constantly happening around us. So limiting your family's exposure to that, obviously staying in the know about the new guidelines and stuff like that, but just not constantly talking about the death tolls and, the new cases and which states are doing this and which states are not doing this, and just trying to stay focused on what you can control and just limiting all that negativity that's going on around you, because it does have an effect on your emotional state 100%. Another thing is just trying to keep up with some kind of routine. I know that's very hard right now, and I know that some parents are having trouble just trying to set a routine for this virtual learning, especially when they're working, and it can be quite difficult. But having some kind of routine is definitely really beneficial, because I know when I'm out of routine, I just cannot focus and I cannot get anything done unless I have something written down and I do something for at least, a couple weeks straight or a month straight. And then I finally see I'm getting results and I'm getting things done, because I'm just so used to doing it and being in a certain zone, I guess, when I can focus and actually get things done. And kids are no different. They need to be in a routine to feel productive and feel focused and feel a little less stressed about, okay, well, I have to do this, but, I did it in this location yesterday, and sometimes it can get kind of confusing. So having a set corner for them, a set room, or if that's not applicable to you, then you can just make do with what you have. It's all about making do with the space that you have, and just finding a good routine for them, whether that's them working in the morning and getting things done then, or if that's the afternoon for them, whatever they are more focused and more motivated to get their work done, that is when they should be doing their work. And I think teachers and school administrators can be flexible. I'm not sure how it is, in everybody's community, but reaching out to teachers and administrators if you know that your child is, not being very motivated and they're losing focus when they're trying to work and they just don't want to do it anymore. So trying to find new resources through the school, and, contacting teachers and counselors about what can be done if your child needs more, they just need more accountability. And so I think that's perfectly fine for you to reach out to them, and I encourage you to do so, because I know that communities are trying to get together and make this more easier for parents, because there is a lot on their plate right now, on your plate. So I think and encourage you to do that if it is an option for you. I kind of want to leave off on the last two with something that can be done on your part. And one of them is just being a role model for them, and, keeping up with a healthy routine yourself, eating well, getting enough sleep, exercising, and doing things to take care of you so that you can perform at your best. Showing them that you do that and helping them and encouraging them to do it for themselves is really going to keep them in a healthy mindset and a good mental state so that they can feel like they're taking care of their bodies, because at the end of the day, that's what really matters. It's about taking care of you, and it's what mental health is really about. So, helping them get on your routine or taking more breaks. So that's kind of the next one, taking breaks and spending quality time and not just, making it all about the academics, especially if they are under stress and they, are feeling irritable and there are behavioral changes that you're noticing, lack of sleep, lack of motivation. And that's your cue that they need to focus on their mental health and they need to focus on them. So taking those breaks, spending quality time, not worrying so much about the academics. Because I think at the end of the day, you need to put the mental health first and kind of leave the academics aside. If you take care of that, you'll notice that the academics and other things that they were once interested in will start to make way in their life. But right now, it's something that they need to focus on bettering themselves. And so spending more quality time with them, taking those breaks, reading, exercising, playing games, spending time as a family, all of those things will really help make things a little less stressful and make it easier for them to cope with, whatever's going on right now. As long as they feel safe and secure and strong enough mentally, then everything else will start to fall in place. But right now, that's the focus. So I hope you found this video useful and I hope you enjoyed it. And stay tuned for next week's video, part 3, and we're going to be talking about communication and connection strategies. And it will be posted same time next week on Wednesday. So stay tuned for that. Bye.